in this time of crisis.
Makes sense.
Have you been in contact around the state or around the four-state region at all, Randy, with your fellow directors of downtown?
Days passing, days yet to come, and the message of freedom. The message of freedom. I stand at the edge of the pages of history, and lessons unlearned. It feels like these pages.
Good afternoon, everybody. Welcome to the afternoon here at 3 o'clock local here in Eastern Panhandle, and I got Matt over there on the technology board keeping me on the air, and we're going to do a little bit of informational shows here for the next hour, and looks like we're going to continue it Monday through Friday. Most of the time I'll be here. I might have some other guests in, or at least on the air, and maybe come in and actually do what I'm doing right now. And a lot of you are sitting at home. Some of you might be outside and miss this, but it will be replayed on my Facebook page. You'll be able to pull it up there. It's live on Channel 10 over here in the Eastern Panhandle for those in Berkeley and Jefferson County. I believe that's on it. It just runs in Berkeley and Jefferson, right? Cable Channel 10, Comcast. The elephant in the room is pretty clear here. It's what's going on in West Virginia, nationwide, and really around the world with the coronavirus. So I want to give you the background that I've researched myself, and many of you are aware of some of this information you might not be aware of. A timeline for the coronavirus. The head of WHO, that's the World Health Organization, is a guy by the name of, he likes being called Dr. Tedros. And he is not a medical doctor. He has a PhD in community health. He's from Ethiopia. That's important to know. He was a part of the Marxist Revolutionary Group, Tigray People's Liberation Front. He formerly was the Minister of Foreign Affairs. And on January problem. The key thing you need to know about his group is, and this has a corollary, a parallel with what's going on in West Virginia, and that is Ethiopia. Is that all right? All right. I'm not used to seeing that up there at the volume because it was lagging. Matt and I are having our first day here. But Ethiopian Airlines continued to fly well into January directly from Wuhan, and that's because China is investing heavily in the Ethiopian economy. They've actually built a 6-lane interstate. They've built a stadium for $160 million. They've invested literally billions of dollars into Ethiopia. And the reason that's a parallel is because of what we're thinking about doing in West Virginia, which is allowing China to invest in our economy, and specifically into our natural gas resources. Now let's talk about the models. The model that came out from a fellow out in UK, originally had up to 500,000 deaths in the UK and up to 2.2 million deaths in the US. He recently has backtracked that a lot, and he has come back and said now that they're expecting the UK to be less than 20,000 deaths. Now, I don't take that lightly. I don't think anybody should. And later on, I'm just going to present facts to start with, and then towards the last half, I'm going to present the solutions to some of these issues, both in the state of West Virginia and even around the world. There was two doctors from Stanford University, or excuse me, one doctor from Stanford University, and he's the head, and this is where one of the things where I think this is maybe blown a little bit out of proportion. And it's because of what we call sample bias in statistics. We are only sampling those people that are sick. That's who we're testing. And those are coming back. In the state of West Virginia, for instance, we're currently coming back at about a 4% positive rate. And so the actual overall population is less than that. And because of that, it's possibly, let me just read a few quotes from this article. And it's important to know who this guy is. This guy is the head of the metadata of the University of Stanford University's medical school. And he says due to the extremely limited testing, we are likely missing the vast majority of infections from COVID-19, he states, thus making reportedly fatality rates from the World Health Organization meaningless. And that's actually backed up also from a Dr. William Schaffner, who's the head of epidemiology at Vanderbilt University, who used to be the head of NFID, which is the National Foundation for Infectious Diseases, for a couple years. So he's a well-researched guy, professor of medicine. And what he said, he actually said this on a news program last week. He said that he said he believes that 70% of the people that get this virus show no symptoms or very mild symptoms, which means you could have a lot of people walk around with the virus. And that's because of the fact that this can spread very quickly. That's a problem. But he said because of that, you have these mortality rates that are greatly skewed. And I ran the numbers. If you take that 70% of the people that get it don't ever have to be hospitalized, don't ever get tested, because everybody's probably heard stories. Excuse me for a moment. Everybody has heard stories of people trying to get tested and being turned away because they didn't quite meet the qualifications. So the mortality rates, running those numbers based on all the data that I had last week that was available, was a mortality rate of, at the most, around 0.5%, which, don't get me wrong, that's not good, but it's no worse than a really bad flu year. The difference is this is more contagious than the flu. Now, what Leonidas did, his name is Dr. Leonidas from Stanford. He said I referenced sample bias. There was one situation that he could use where an entire closed population was tested, and he used the Diamond Princess cruise ship, and that's where they had a fatality rate of 1%, he points out. But the population was largely elderly people going on a cruise. He projected that out onto the age structure of the U.S. populations. He calculated the death rate is more like 0.125%, so about 0.25%. And that's a range of a low of 0.25% to 0.5%. So that jives with the numbers that I figured just doing rough data. Now, the other thing he said that's very important, and this is for those who argue that the high fatality rate among elderly indicates that the death rate cannot be as low as 0.05%. And this is the last thing I'll pull out from him. He notes that even some so-called mild or common cold type coronaviruses that have been known for decades can have fatality rates as high as 8% when they infect elderly people in the nursing home. And, you know, it's difficult for anybody to lose a loved one, but it's a whole other thing to drastically shut our whole population down. There needs to be a balance, and I believe that we have basically we're out of balance in our reactions to this virus. So, Matt, you ready for a commercial break yet?
Sure. Jim Justice was Hillary Clinton's running mate, and Woody Thrasher backed Justice's tax hike. Mike Folk led the fight against it and won. Mike Folk, taxpayer hero, for governor because West Virginia needs a conservative champion. Mike Folk, putting taxpayers first.
I'm Mike Folk. Jim ran as a Democrat, and Woody was one less than a year ago. Neither supported Donald Trump. I did. I'm Michael Folk, a pro-Trump Republican running for governor because it's time for a conservative change.
When will I be able to retire? How do I make the most of the money I have? How do I leave a lasting legacy to my loved ones? I'm Philip McCoy, financial advisor with the Mirius Group, a private wealth advisory practice of Ameriprise Financial Services Incorporated. Call us today at 304-263-4343 to help you make the most of your financial future. Our office is located at 1270 Winchester Avenue, Martinsburg, West Virginia.
Ameriprise Financial Services Incorporated, member FINRA and SIPC.
Orsini's, not just an appliance store anymore. They're your one-stop resource for all home needs, whether it's custom kitchen design, countertops, or cabinets, or check out their new sleep studio with Tempur-Pedic, Sealy, and Stearns & Foster. For all of your outdoor living needs, Orsini's has Gladiator Garage Works, Traeger grills, barbecue accessories, barbecue rubs and sauces, and every flavor wood pellets. Visit their brand new 8,200 square foot showroom at 360 Hack Wilson Way, 304-267-7251, Orsinis.com.
With 4 new car dealerships and 4 used car dealerships in 3 states, Parsons is the largest used car and fastest growing new car dealer in the tri-state area. Take Parsons Ford with huge savings on hundreds of new Fords, financing from 0%. Parsons' goal of financing for all. And Parsons' famous above-market trade-in allowances that help make Parsons #1 for used cars, too. See why so many won't buy anywhere but Parsons Ford in Martinsburg. We became #1 by making you #1 first. Parsons.
All right, welcome back, and thanks for that. First, the next thing I want to address is there have been many people, and this is the state level, federal level, pretty much all levels of our government in the U.S. and even worldwide in some respects, that say that this is something that man has never seen. Man has never seen. Well, I'm just right here. I'm on the CDC website. We'll use their own data. And the one thing that, the most recent one that we'll all be familiar with, anybody at least that was old enough to read and watch the news in 2009, was the H1N1 pandemic. Now let's talk about that, because this is a really interesting case study for us in the U.S. especially, because it originated in the United States. And that pandemic had about 20% of the population were infected. Matter of fact, Matt Crawford said he had that flu in 2009. I wasn't aware of that until I was in here the other day talking to him. And the interesting thing about that, so we had about 60 to 61 million of our population infected. The mortality rate, I'll just read the numbers right off here. CDC estimated 60.8 million cases, just under 275,000 hospitalizations, and about 12,500 deaths. And the range for the deaths were as low as about 8,900 to a high of about 18,300. So, but the key thing about this, the last pandemic that is important to know, is that it did not affect the older population. It actually affected those younger than 60. Globally, the deaths were estimated to have occurred in people 80 to 80% of the virus-related deaths were estimated to have occurred in people younger than 65 years of age. This differs greatly from the seasonal flu, which typically kills about 70 to 90% of the people who are 65 or older. So we have seen this type of pandemic before in the U.S. Now, I actually ran some numbers. Of course, the one that everybody talks about historically is the 1918, 1919, about a little over 100 years ago flu. And worst case scenario, these are literally worst case scenario based on the data relative to population, because that's important, because we only had about 90 million people back in 1918 in the U.S. And in that case, I think it was 1.625 million. Let me pull it back just so I don't misquote the numbers. One third of the world population got it, and yes, I was about 675 million of the deaths occurred in the U.S. Now, to put that in perspective, based on that population, to have a similar outcome as far as worst case scenario as 1918, we would literally have to lose them. We'd have to lose about 2.5 million people in the U.S. That would be devastating. Don't get me wrong, but that's the worst case scenario. Now, the one thing I want to talk to you about is there's an article, a professional article that was written in 2007. This was somewhat foreseeable. This is an article that was written in the Clinical Microbiology Review of October 2007, American Society for Microbiology. And it's titled, Severe Acute Respiratory Syndrome Coronavirus as an Emerging and Re-emerging Infection. This is why everybody talks about getting rid of this all completely. That's not reality. It will come back. Viruses mutate. I've had several conversations with very high-level people. Some of them were lifelong friends. One guy has a PhD in genetics, studied at Dietrich for a long time. But this is the title of the article, and I'll just show it to you real quick. Does that show pretty good there, Matt? The thing that the highlighted portion is an important thing. Again, this was written in 2007. It says right here, the presence of a large reservoir of SARS-CoV-like viruses, what we have here, we call the coronavirus now, COVID-19, in horseshoe bats, together with the culture of eating exotic animals in southern China, is a time bomb. That's in a professional article. Now, this is something I don't think anybody's heard. I have a friend that is a lifelong friend. I just mentioned I'm not going to mention his name. He works for one of those alphabet agencies that are involved in this in D.C. And he said, when I spoke to him recently, that they know where it came from. Let's just put it that way. And it had to do with what I just said. It's a known fact that the market where this was found is about 20 miles from a facility that studies viruses. And some of those animals that they study viruses on, somebody decided to take them to market, to put it bluntly. So it was a time bomb waiting to happen. Now, I want to address a little bit of what some people have said with this we've never seen. I've already said that we have seen it before. Now, the other thing that is important to note, and I'm going to quote a doctor here. This is our coronavirus czar. What's his name? Clay Marshare. He stated about a week and a half ago, to quote him, "We are faced with a pandemic by a virus that we have no immune system that responds to, so we can't fight it." Well, if that statement were true, we currently have, and this is where I really believe that we need to quit exaggerating things from a public official's perspective. The latest numbers from Johns Hopkins counters, and this is from early this morning, I believe, 737,929 worldwide confirmed cases. But we have 156,507 people that have recovered. Matter of fact, I believe, Matt, the first gentleman that was James Vigil down in Shepherdstown, he's got a clean bill of health. They actually did an article on it. So he's now clean now. So that's not true. Now, the solution to make sure this doesn't happen again, and this is all policy from here on out. We have, by the way, Matt, just a FYI for me, is that 1 minute? What's that countdown for? On your right screen. Right. No, right screen. Right. No, the next one over. Oh, over here? What's that 50 seconds mean? Nothing for me? No. All right. That's the radio show. All right. I'm getting used to this to see if I have 30 seconds to go before the next break. But so we have a thing in West Virginia called the Certificate of Need. And it has been in effect. And for those of you who have never heard of Certificate of Need, the rest will be very educational. Certificate of Need is basically where you have to go to in West Virginia. It's called the West Virginia Healthcare Authority, and ask for permission to provide a healthcare service. And we have the 6th most expansive certificate of need process in the whole country. Anything from MRIs to hospitals to surgery centers, you have to go get a certificate of, have to go ask the government for permission. But what most people don't realize is why we have that. It was a federal mandate that was passed in 1974, and it was supposed to do 3 things. It was supposed to provide for lower healthcare costs, it was supposed to increase access in rural areas, and was supposed to increase quality. West Virginia passed their Certificate of Need law in 1977, and we've pretty much done nothing but add to it ever since then. And again, I said we have the 6th most expansive Certificate of Need law in the country. So the federal Congress did something that was unheard of at the time. They actually found out after several years that it didn't do any of those things. In fact, it did the opposite. It decreased access, increased cost, and decreased quality. So in 1986, federal Congress repealed that federal mandate. And that federal mandate was, if you wanted to get federal dollars for Medicaid, Medicare, then you had to have a Certificate of Need law. So in 1986, Congress completely repealed that law. From that period of time on, it took up to now, there's been 15 states that have completely repealed their Certificate of Need law. Other states have greatly reduced those things that are subject to Certificate of Need. Like, for instance, a good example of that would be Oklahoma. The state of Oklahoma, the only things that are subject to Certificate of Need are nursing homes and psychiatric hospitals. West Virginia has not repealed theirs. And the reason that's important to note is that, we've talked about having to flatten the curve for the virus, and because we don't have enough beds. Well, that Certificate of Need law restricts anybody from opening a hospital anywhere in the state. And in fact, if you live in the Fairmont area, you'll be aware that Fairmont just shut down their hospital. And they're trying to get an emergency Certificate of Need so WVU can open a smaller hospital. If you didn't have the Certificate of Need law, they could do it immediately. And another reason that's pertinent is because the governor was asked last week, or I believe it was last week in one of his press conferences, because there have been 2 groups that came out and asking for him to suspend the Certificate of Need law in the state of West Virginia. One was the Americans for Prosperity, and the other one is a think tank out of Charleston called the Cardinal Institute, that both of them believe in free enterprise. And that is anything but free enterprise. And so the governor said it would take 18 to 24 months to build a hospital. He doesn't understand Certificate of Need. The Certificate of Need is just literally, if you got rid of it, you wouldn't have to ask permission. There are a lot of existing buildings out there around the state that could be repurposed on short notice to handle a situation like this without having to go to the government for permission. And since he likes to, look to New York as an example at what they're doing, New York actually suspended a lot of their Certificate of Need laws so they could get beds available. So now, some will tell you that the hospitals need to be protected. How much time we got there, Matt?
Another 4 minutes if you want to take another break.
Well, I can start talking about this next, because this gets to be a point. So people say the hospitals need protected. So we have them. I'm right now looking at a document, and I'll show it to you. And this is a little bit older one. The latest that's available is 2017, but I brought it in 2016s to make a point. This is an IRS 990 form for the main West Virginia hospitals up in Morgantown. They have multiple nonprofits that they run their hospitals under. But this one in particular, their total revenue in 2016 was $882,811,000. Their net revenue, in other words, revenue less expenses, this is a nonprofit, which, just for clarification, nonprofit does not mean you don't make a profit. It's a tax status. So in the case of WVU Medicine up in Morgantown, the main one, they netted $104,880,000 in 220s, $104,880,000 and change. But now it's important to look at some information for how much they pay people. Because a nonprofit, my gosh, they just wouldn't be paying if they're really trying to provide a service at a reasonable cost, they wouldn't be making a lot of money now, would they? The head of WVU Medicine Hospitals, Mr. Wright, when you add up all of his money that he makes, it's well in excess of $1 million. Vice President of Finance, over $500,000. Marketing and Communications, over $300,000. The chief HR person making almost $200,000. I think they could use a little competition. I don't think they should have anything to fear from competition. I think our quality of access would increase. Our quality, our access, and our cost would decrease. And in case of our cost, it would decrease. Another thing that is important to know is how many people have ever went to a hospital, WVU for instance, perfect example, and you typically get 2 or 3 bills. You get one from the hospital, and then you get one from another group. And that group is probably called University Health Associates. And that is basically a nonprofit set up for the doctors. Another IRS 990. And you'll be amazed by these salaries. Most of these are university medical professors, who also are obviously MDs. And I'll read a few of their salaries. Oh, this one doctor makes almost $1 million for this one. This one makes almost $1.9 million. Another one makes almost $1.3 million. And these are just their nonprofit salaries from University Health Associates. That doesn't include their 6-figure salaries as professors at WVU, which are somewhat subsidized by the state taxpayers through things like the POP tax, as an example. Now, why? Not really why. I'm going to show you a third entity here. We need to take a break? And we'll go one more because we went a little short last time anyway. So one last entity here is called the West Virginia Hospital Association. This, again, they're IRS 990. Now this gets really good. This guy's got to be probably the highest paid lobbyist in Charleston, West Virginia. His salary is just under $1 million. Let me get it here because I want to show you this. You really need to see it to believe it. I won't show his name. I don't want to get him mad at me. He's probably already mad at me anyway. But you can look at that. You can add the 769 and the 210 together. It's just under $1 million to lobby in the state of West Virginia. And then the one thing I didn't show you on that West Virginia Hospitals Association is their association fees, which is $1.6 million so far. So I think West Virginia University could use a little competition. And with that, I'll let you take a break, Matt.
West Virginia has enough problems without subsidizing refugees from terrorist nations and gang-infested countries. But that's what Governor Jim Justice endorsed. And Woody Thrasher supports Justice's plan. Makes sense. Both supported Hillary Clinton for president. Only one governor candidate says no to open borders and bringing refugees to West Virginia. Mike Folk. Mike Folk for governor. Defending our conservative values. Taking care of our own. Mike Folk for governor. Fighting for us.
Since 1997, with a reputation of quality, creativity, and personal touch. Let Pro Design build or redesign your dream website. Find them online at professionaldesign.com or phone 304-676-9940.
West Virginia has enough problems without subsidizing refugees from terrorist nations and gang-infested countries. But that's what Governor Jim Justice endorsed. And Woody Thrasher supports Justice's plan. Makes sense. Both supported Hillary Clinton for president. Only one governor candidate says no to open borders and bringing refugees to West Virginia. Mike Folk. Mike Folk for governor. Defending our conservative values. Taking care of our own. Mike Folk for governor. Fighting for us.
Bold and savory.
Why are you always talking about me?
Actually, Rod Hawker Dog Hawker, I was talking about the soup sale at Johnny's.
Sweet! Now with new varieties and your reliable all-time favorites, it's soup sale time at Johnny's.
Hearty and flavorful, choose from new varieties like Pilgrim's Corn Chowder, Stuffed Green Pepper Soup, Lumberjack Vegetable, and Phillips Cream of Crab.
And don't forget rip-roaring crab and corn, steak and ale chowder, French onion, Maryland crab, and chicken noodle.
The perfect comfort food. Johnny's soups are still quick, easy, goof-proof, and delicious. Just add water or milk, cook, and serve.
And of course, you'll find all the soup bowls, soups, ladles, and storage containers you'll ever need, and soups on sale at Johnny's. Right up and down the J. River Johnny's Express, Winchester Avenue, Martinsburg.
This is Eric at Hagerstown Ford. Over the last decade, the way we buy things have evolved. Now, you get on your phone, click Want It, and it shows up at your front door. At Hagerstown Ford, it is that convenient. We've changed the car buying experience on the I-81 corridor forever. And with a return policy better than Walmart, there's absolutely no reason to buy a new or used car, truck, or SUV anywhere else. Just like Amazon, Hagerstown Ford will deliver the vehicle to you, where you are, and on your time. And if you don't want it, return it. No questions asked. Why waste your time at a car dealership playing the dumb back-and-forth games? Besides, we hate it more than you do. I assure you, no dealership from Winchester, Virginia to Washington, D.C. will beat our price. No dealership from Chambersburg, Pennsylvania to Baltimore, Maryland will beat our price. And no other dealership will allow you to return it if you don't want it. Hagerstown Ford absolutely provides the best experience at the best price. Visit HagerstownFord.com to schedule your VIP experience. Click on the vehicle you want and get your new ride delivered to you at no risk. See dealer for details.
Songs as I write you this letter, of days past and days yet to come, and the message of freedom.
Thank you, Matt. All right, let's go on the positive side now, and let's talk about what some other places have done and been successful with in dealing with the coronavirus, and a very promising treatment that is. What's wrong, Matt? Oh, did I? I got bumped. Okay. Matt's good at fixing things. And this is an article. It says why Taiwan hasn't shut down its economy. And it's an article actually by some fellows from, actually I don't have the authors here, but it was written by Mises.org. You can find it there. And just to give you an idea what Taiwan is, Taiwan, the capital is Taipei. They have a population of about 2.6 million in the capital. They have direct flights, Matt, right to Wuhan, China. And they kept them going. They shut them down in January sometime, so about 6 weeks after the outbreak. And the country of Taiwan has about, it's over 25 million people. So obviously not the size of the U.S., but interesting because they do have a pretty sizable dense population in Taipei. Not near as big as New York. New York is about just under 8.4 million people. So I'm going to read a little bit of this article because it's very interesting. At the moment in Taiwan, the infection has been completely contained despite one of the countries with the highest risk of suffering a pandemic because it's obviously real close to China, mainland China. And they had daily flights from Wuhan, China, which is the epicenter. I don't know if most people don't realize this, and this is one of the things that you have to keep demographics in mind when you're dealing with a outbreak. You have to take the top, I believe it's 10 cities in the United States to equal the size of Shanghai alone. New York is the largest city in the U.S. It's just about 8.4 million people. You have to add that up with L.A. and all the other cities up to about the top. It's 8 or 10 to equal the population of Shanghai, which is 35 million. And the interesting thing about Wuhan is just slightly smaller in population to New York. It's about 50,000 people less than New York. So keep that in perspective. So as of March 21st, so this is about a little over a week old data, there were only 153 infected people in Taiwan. Not just a little bit more than what West Virginia has, and they've been dealing with it for about 3 months now. At the same time that Europe, far away from the Chinese mainland, has more than 10,000 affected by the coronavirus. However, in Taiwan and other parts of Asia, including Singapore and Hong Kong, no massive mandatory quarantine or containment has been applied so far. And the important thing is to know the reasons, what they've done different. The biggest thing they've done, which I don't think we've done a good job at in West Virginia or as a country, is transparency of information. We just have not told people. So I'm just going to read this real quick. The first cause of Taiwan's success is the transparency of information, which stopped the rapid growth of infection. The containment in Taiwan has been carried out with relatively high transparency. As early as December 31st of last year, the Ministry of Health and Welfare of Taiwan began to take serious the potential danger of the Wuhan pneumonia, informing citizens every day about the developing trends of the infection and its status. The information provided by the Taiwanese authority also includes whether the infected in Taiwan contracted the illness from overseas input, which helps people take measures to protect themselves in a timely manner. In the constant press conferences, the Taiwanese government provides different options and recommendations that people can choose to adopt voluntarily, but are not imposed coercively. The abundant information provided continuously allows individuals to make their own informed and balanced decisions. Now, the only thing they did do that I could see was mandatory, fairly mandatory, is if you flew from Wuhan, which was the epicenter of the epidemic, of the pandemic, and you flew to Taipei, they tested you, and even if you didn't test positive, they quarantined you, wanted to have you self-quarantined for 14 days. So that was a big deal. Now, by the way, Matt, I want to make everybody know, 263, I'm going to take questions, any questions, as long as you ask a good question. The phone number is 304-263-6540 if anybody has any questions, and we'll take questions the last 15 minutes. The last thing that I think is very important to discuss is something that I read. Actually, Rudy Giuliani interviewed this guy in a video. You can probably Google it, and he's a New York doctor. His name is Dr. Vladimir Zelenko, and you've probably heard of the hydroxychloroquine. I'm not sure if I'm pronouncing that right, but he's developed or has been experimenting with a regimen, and he's had this says 699 in his interview with Rudy Giuliani. He says 500 to 600. But Dr. Vladimir Zelenko has treated, the title of it, has treated 699 coronavirus patients with 100% success. At least, I don't know if that would be I would term it success. But what he said in his interview is basically he's testing everybody up there. He's getting about a 59% positive, and that matches what even the governor's numbers have been. Up in New York, it's between 30 and 50%. And that's because of the dense population, and he really didn't do anything soon enough. And having flown into New York, in Newark, New Jersey, you take the whole New York metropolitan area, which includes Jersey and everything, you're probably well in excess of 10 million people easily. So, and they're literally on top of each other. But what he's done is he has had no deaths in those people he's treated. It's a 5-day regimen that only costs $20. And he's getting ready to publish this. He's working on the document right now. And it says right here, 350 patients have completely recovered. He's only had 4 hospitalizations. And what he does is he uses the hydrochloroquinine, and a Z-Pack, which is your zinc and your azithromycin. And the reason they do the azithromycin is in case you get a secondary bacterial infection, it's an antibiotic. And also, just to back this up, a study by the National Institute of Health also confirmed some of Dr. Zelenko's findings. That says the study by NIH showed that zinc, by the way, what zinc does, it basically prevents prevents the virus from increasing and spreading. And the hydro, I'll just call it hydro, makes the pathway for the zinc to get in and do its job. The study by NIH showed that zinc supplementation decreases the morbidity of lower respiratory tract infection in pediatric patients in the developing world. A second study, also conducted by NIH, in vitro antiviral activity and projection of optimized dosing design in hydro for the treatment of severe acute respiratory syndrome. And that's, by the way, that's what kills the people, is the ARSD, I believe. It says also showed hydro to be more potent in killing the virus off in vitro, and that's in a test tube. They tried it in a test tube. So we do have optimism. No calls yet, Matt? Not yet. We'll go to the next topic. Actually, why don't you just go to a break, and I'll pull something else up.
Jim Justice was Hillary Clinton's running mate, and Woody Thrasher backed Justice's tax hike. Mike Folk led the fight against it and won. Mike Folk, taxpayer hero, for governor because West Virginia needs a conservative champion. Mike Folk, putting taxpayers first.
I'm Mike Folk. Jim ran as a Democrat, and Woody was one less than a year ago. Neither supported Donald Trump. I did. I'm Michael Folk, a pro-Trump Republican running for governor because it's time for a conservative change.
Prepare for what's next, or to plan ahead. We're here. Brown Funeral Home, a legacy of service since 1880.
Howdy, cowpokes. Do your business cards look like they were designed by a coat roper? Well, this cowboy knows the advantage of dealing with folks the old-fashioned way. When you order printed material on the internet, you're stuck with what you get. But when you need printed material to look just right, you want to deal with folks you know. And that's what you'll find at Panhandle Printing and Design. Local folks that have been delivering results for years. They can help with everything from design to production of stationery envelopes, business cards, invitations, vinyl signs, banners, vehicle wraps, and a lot more. They can answer all your printing questions, and you can call them on the phone or hop on your horse and go see them, because they're your one-stop printing shop where they have something for everyone. Panhandle Printing and Design at 124 North Maple Avenue in Martinsburg. Call 304-267-7400. You can even find them online, too, if you want to. If you need printed materials, don't deal with some city slicker you'll never meet. Trust the folks at Panhandle Printing and Design.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is, why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
Welcome back. And I want to revisit something that I forgot to mention on the, did I hit it again? Oh, looks good, okay. The H1N1 in 2009, the different thing about that, and the reason they determined later through research that it was killing the younger people and not the older people, was that they figured out that the older population, 65 and over, had actually built up some antibodies from previous pandemics. And the ones that the older population that may be listening to this may remember would be, there was actually a H3N2 pandemic in 1968, and there was one also in the late 50s that were important to know, and they had built up some antibodies. I am going to talk a little bit about taxation right now. And if you haven't watched it, this is if you haven't watched this, this video I would suggest you watching if you got plenty of time at home now these days, right, Matt? There's a video from 1964 called "A Time for Choosing" by Ronald Reagan. It was literally the speech that launched his political career. And that's where I get the phrase, the more the plans fail, the more the planners plan. And he also says in that speech, outside of its legitimate functions, government does nothing as well or as economical as the private sector. And in that speech, he also talks about how the tax burden on the U.S. citizens at that time in 1964 was 37 cents of every dollar of their money went to the government. Now, you probably wonder, what is it today? Well, I ran some numbers for the state of West Virginia, and these are found from valid websites, census data as an example. And these are, I think the latest numbers are like from 2017, 2018 timeframe. And at that time, the per capita, that's per person income, in other words, if you have a 4-person household, it would be per person, so you'd be just under 100,000. But the per capita income in West Virginia was $24,478. Now, the tax burden in the state of West Virginia, state and local taxes, in the website I found, which is a pretty reputable website, was $9,000 for every man, woman, and child. And the federal tax burden in West Virginia was $3,900, just under $4,000. So that's around a $13,000 tax burden per person. You divide that by the per capita, and you have a tax burden in the state of West Virginia, state, local, and federal, of 53%. So the government, at some level, controls currently about over half of our spending. We are headed in the wrong direction, West Virginia. We're headed in the wrong direction, United States. It's time for somebody to take a stand. I hope to be that person. I think we need to run our budget like we run our household budget. You know, in 2017, and this is where I have to start comparing myself, and this is just stating fact. I compare myself to Jim Justice. Jim Justice ran on a platform of not raising taxes in the state of West Virginia. He said he was a businessman. He said he could balance his budget without raising taxes. What's the first thing Jim Justice did in the state of West Virginia in 2017? He proposed a $450 million tax increase. That included a commercial activities tax, which was a whole new tax, a 10-cent increase in the gas tax, double your DMV fees, he also was increasing the sales tax 0.5%. And at that time, he called the state of West Virginia the equivalent, and this is kind of ironic today with what's going on now, with actually having people dying from a virus. He called the state of West Virginia a equivalent of a patient on its deathbed. The only way to save it was to raise taxes. And my other opponent said they had to do it too. There's an article by Brad McElhaney in Metro News saying he supported the tax increases too. Now, I got tired of hearing that same phrase from Jim Justice over and over, and you all have heard many phrases over and over. And in this case, it was the, West Virginia, it was on life support, basically. Well, a small group of us in the West Virginia House of Delegates took it upon ourselves to develop our own budget. We literally did it around the kitchen table. And Pat McGeehan, Marshall Wilson, Tony Painter all played a part in that. Marty Gerhardt played a part. I got ideas from everybody. We put a budget in. And at that time, the state was trying to give a 2% pay raise to teachers too. So we put a budget in without raising taxes during that regular session, put that budget in to prove it could be done and still give the teachers a pay raise without raising taxes. That's a lot of the elements of that budget ended up on that budget that was vetoed on a silver platter with a cow patty. Later, we went into special session that summer, and that initial budget in the regular session only had a half a dozen signatures on. You're allowed to have 11, counting the lead sponsor. And by the time we went into special session, I had a full slate of sponsors. Another guy that got on that was, like I said, Marty Gerhardt. I had many people that wanted to be on the budget that couldn't be put on the budget. We stopped the tax increases during the regular session, but during the special session, he did get the tax increases on the gas tax, at least some of them. He got the DMV fee increases. He also, if you live in southern West Virginia, you'll appreciate this, or maybe not so much appreciate it. The tolls were going to be gone a couple years ago. The tolls would have been gone, and I think it's July 1st of last year, the toll booths would have been coming down in 2019. But because of that special legislative session where he rammed through increasing, he actually doubled the tolls and extended the tolls so he could borrow more money. So people in southern West Virginia are starting to pay those tolls. But the general revenue tax increases, we denied him, allowing him to raise those. And that was from a small group of legislators in the House that stood their ground. How we doing on time, Matt?
About 8 minutes.
About 8 minutes left. Nobody wants to call in.
Give that number again.
304-263-6540. Oh, I know what I can talk to you about. Since we're talking about budgets, I've got some numbers here. So West Virginia's budget, when Joe Manchin first took office in 2005, and this is important to note, because I guarantee you, your budget hasn't grown as much on average as the West Virginia budget. The general revenue budget in 2005 under Joe Manchin was $3.19 billion. In 2010, when he left office, it was $3.74 billion. And I pulled the inflation numbers up from 2005 to 2020. And a dollar in 2005, what you could buy with a dollar in 2005 and 2020, this is earlier this year. There's an inflation calculator available online, Matt. It took $1.32 for what you could buy in 2005 for a dollar, take $1.32. And our budget from 2005 to 2020, let me run some, okay. 2015, our budget was 4.3. 2017, general revenue would be 4.2. So what we're getting at, our budget today, if it just kept up with inflation, should be, instead of West Virginia, $4.21 billion. It's actually about $4.5 billion. So we've actually grown our government, just our general revenue portion of our government, faster than the rate of inflation. And when you get back to that 53% again, now you see why it's 53% and hasn't come down. It doesn't even, we're growing government faster than the rate of inflation. Tomorrow, if you have any questions, please reach out to me on Facebook. That's Michael Folk for West Virginia Governor. If you have any questions, if you want to friend me on Facebook, I'm also at Michael Folk, that's F-O-L-K. If you want to email me a question or any information that you want me to discuss, the email address is mcfolk, that's F-O-L-K, mcfolk@34 gmail.com. How are we doing on time, Matt?
Couple more minutes? Or
2 minutes.
Wrap it up?
We're going to wrap it up. And also, if you like what you hear to say, if you like what you've heard today, please get on Michael Folk for West Virginia Governor. That's on Facebook. Like the page, share it. If you have a question, you want to talk to me personally, my number is 304-279-6797. And we'll get some really good data and policy to talk about tomorrow. We're going to do this again at 3 o'clock tomorrow. This is our trial run. I now know, Matt, that I probably need to get a little more information or take more phone calls. So you all have a great evening. Be safe. Keep your space. Take care of your neighbor. Check on your if you have older neighbors or older relatives, please check on them. Call them. Specifically call them. See if they need anything. Go to the grocery store for them. My biggest concern with what's going on right now, and I think most of you have this same concern, is our grocery stores. I just went to the I don't go very often. I live on a farm, and we have raise our own animals and stuff. We really only have to go to the grocery store for bread if we don't want to bake our own, and maybe some fresh fruits. But the thing that I noticed at the grocery store is we have a lot of people in the grocery stores, and it's hard to keep that 6-foot barrier, and that's why I think we've really went overboard in stopping our economy in West Virginia, and we need to change that. Again, if you have any questions, what do we got, about a minute left? We're about done. We'll go replay this. If anybody has one of their friends wants to watch it, or you've watched it and think your friend should watch it, it'll be up on my Facebook feed. So have a great day. Have a good evening. Be safe.